Next, we have a head injury. Head injury is a pathological condition which may occur due to mechanical force, scalp and meninges and brains are affected, and it can be happen due to any force. So open head injury, in which a fracture opens the skull and penetrate the skull by an object, and close to, in which it's a blunt trauma. There is a chances of like a bleeding inside and increase ICP. For example, shaken baby syndrome, in which they take the baby and shake their head so hard, shake the baby so hard that the brain inside hit the skull and leads to injury inside, right? So level of consciousness provide the earliest indication for the improvement or deterioration of the neurological condition. So you have to be very careful in assessing the level of consciousness, that GCS score. Types of head injuries we have is concussion, which like we had the hit somewhere, so it's headache, like headache, confusions, dizziness can occur. Contusion, bruising of the brain tissue. Skull fracture, there is a bone breakage. Hematoma, in which there is a collection of blood outside the blood vessels. Epidural space and those spaces, and diffuse axonal injury, widespread injury to the brain, white matter. So these will be the types of the head injuries. So earliest sign of the head injuries is changes in vital signs, changes in level of consciousness. Infants will show irritability, high pitched cry, bulging spontaneously. Headache circumferences is increasing in case they have too much of fluid collection. A McQueen sign, crackpot sound on percussion of the head, and setting sun eyes, like their eyes will be low set. And in child they have a headache, nausea, vomiting, diplopia and seizures. So late signs is decrease LOC in bradycardia, decorticate position. So in this decorticate position, what happens, the child is holding their arms onto adduction of the arms at the shoulder, like they are holding their arms to the chest, very flexed position, and the wrist and they are lying very straight, extremities are very extended. So in decebrate position, which is an extension posture, in which the arms are on the side and they are extended outward, and the foots are extended outward as well. And then they have giant stroke respiration, in which they breathe and then stop breathing, then stop breathing again, and then coma can happen. So intervention is side rail should be up, head immobilization first of all, airway, evaluate airway, administration oxygen if they are not able to breathe, assess the injuries and neurological status. So detect signs of increased ICP, which will be from vomiting, headache, severe headache, sudden vomiting, projectile vomiting. CT scan and MRI, neuro check every 15 minutes. Then just rest and gradual activity. Medication will be used to help reduce the edema in the brain, and surgical intervention to drain the fluid if there, and safety and prevention like side rails, padded side rails, NPO, nose dating medicine. If fever, use tepid sponge, avoid suction through the nose if you don't want to open their nose. So waterproof mattress, and a child identification band, and swimming activity should be done with someone else, not alone, for seizure precaution. So next we have IV fluids we will give to avoid carefully to avoid cerebral edema. So do not give them too much hydration. Overhydration can leads to a buildup of fluid in the brain, which leads to cerebral edema, and which will compress the brain more. And if they are done the surgical intervention, you have to assess the site for dressing for the presence of drainage, CSF leakage. So when CSF sometimes leak through the nose or the ears, you will see a colorless fluid coming out of their nose and ear. Then you will test that fluid with a glucose strip, and if it's a circle present, it means that it's positive. So for that, and osmotic diuretics and corticosteroids can be used. So drainage from the nose or ear needs to be tested for the presence of glucose. Drainage that is positive for glucose means indicate leakage of CSF, which has to be informed to the doctor immediately. And whenever the head injury occurs, we have to immobilize the neck and spine immediately after head injury. So you're not allowed to move the patient of your own if they have head injury. So they should be kept